As in other years, what we tried to focus on, first of all, is having companies that are both earlier stage and later stage, because different investors are looking for different things. But within that, we tried to be fairly consistent in taking a look at the range of criteria that any investor would be interested in when they're thinking about which companies they'd like to partner with. So that includes, the management team, their backgrounds, their professionalism, their ability to execute on their plan, their track records. It includes the technology itself and the innovativeness. How does it stack up against competition? What's sort of the secret sauce and how defendable is that long term, and the barriers to entry? The market and the market size, understanding, is this a small innovation in a big market or a big innovation in a big market, or et cetera, because that helps us understand what piece of the pie this company is ultimately going to be able to capture. And then other things around go-to-market strategy, have they thought about their sales channel? If it's a revenue stage company, what's their traction so far, or what are some of their early indications of commercial success? If it's pre-revenue, how well do they understand the customer base, the stakeholders, the decision-making process, et cetera. So it's really trying to mimic in a lot of ways, and IP and things like that as well, clinical data, to the extent that it's a clinical data-oriented company. The same sorts of things that any investor is going to look at when we're deciding which investments to make for our funds. And so the goal is really to make it like a real pitch situation for these companies and evaluate them on the same criteria that any VC or investor is going to be asking them to make the case for investment later on. In terms of the award winners, it was a very tough decision this year. We have a lot of great successes, actually. It's been a good year for medtech and digital health. And so we had 3 award winners. On the digital health side, it was a little bit of an interesting story because this was a company that ultimately ended up being privately financed, so was not a VC-backed company in the end. And I think what we heard from eDevices was really the story of a very true entrepreneurial story where sometimes things don't always go according to plan. The Mark Barbieri talked about having a vision for the future that was too early at the time he was trying to raise financing, and how he had to be patient, how it took a long time and a long journey to get to a successful exit, but he had the patience and the vision to kind of follow that path where it went, and to, at the right moment, find the right kind of acquirer to take the business, and in the meantime, convince customers that there was a real value there. So that's sort of one flavor and one kind of interesting way that you can bring a company to success. With the example of Symetis, which is an aortic valve that was sold to Boston Scientific, sort of more the classical device model, again with some twists, where this is a company that had been around in the market for a long time, was 16 years from the original investment to exit, and so some rocky paths along the way, but at the end of the day, it was a company that was competing in a highly competitive space against the big players in the medtech industry, but with a highly differentiated product, achieving sales, stealing share from the big players, and that actually planned to go IPO. And at the end of the day, the CEO, Jacques Esseigneur, was able to get the IPO lined up, and that in some ways, along with other things in the market, achieved the ability to get the attention of one of the big players who needed something else in their portfolio at that time and get a very nice exit for the technology. So that's sort of a commercial stage European company that was on the market for a long time, kind of doing their homework, doing their job, and running the business, that managed to get acquired sort of at an opportunistic moment for an acquirer. And then the third example, Naravi, also a medical device company in a very exciting growth stage as well, which is as they were commercializing in Europe and doing clinical work in the US, they had been also focused on running their business, but in a highly growth segment of medical devices, which is in interventional neuroradiology for stroke. There's been a really interesting progress in that industry. Players are being very acquisitive in that space, and these guys had a very solid technology that they'd invested a lot of time and energy in, and hearing the acquisition by Johnson & Johnson this year was a big coup for the investors, and also represented a great return for investors and for the company. So 3 great success stories. We're very happy to be able to highlight those. I think we've had a lot of great panels on that and discussions on that, both in the cocktail hours and the breaks, as well as from the panelists. But some of the key themes that have been discussed at this meeting and that I see are really on the device side. We understand that more and more having a very interesting differentiated technology. It's not enough anymore. The model has changed. We are even more focused, and at my fund where we're growth oriented, focused on what happens next after you bring the product to market. Can you get reimbursed for this product? So there's a lot more focus on, in addition to the changing regulatory environment, how are companies getting reimbursed and paid for their products? You can't just bring a better technology that adds cost into the system. You have to bring a better technology, but that also has an argument for why it adds value to the system, and I think that's evolved over time. It's not such a new trend, but it's an increasingly important trend. On the digital health side, I think there's a lot of interesting themes, but I think, again, it comes back to sometimes there's information overload, so there's a lot of companies working on interesting technologies, but what's really going to bring value to the providers, to the payers, to the patients? Having another app or a wearable that kicks off more data, or that a physician is going to have to get bombarded with data, isn't enough. You really need to think about how are you streamlining workflows, where are you adding value to the system, maybe in a very selective but very important way, and we've heard some great examples of that here at the conference. I think the European market for health tech, it's evolving, and what's great about Europe and what's also challenging about Europe is that we have so many different countries with so many different systems. And whereas in the US, it's a big market, there's a high regulatory barrier, but then once you're in, you have sort of one market that you're dealing with from a regulation and in some cases reimbursement story. In Europe, we have to be more nimble. We have to understand the nuances of each of the markets that we're in and the dynamics. And so I think, savvy European companies who are able to navigate across the boundaries of European geographies are, in some ways, they're better equipped to deal with the way that the businesses are changing over time. I think, ultimately, the US-based acquirers, because a lot of the acquirers in these industries are still big US-based multinationals, they are going to appreciate more and more the sophistication and the agility of the startups in Europe, because they've already demonstrated earlier in their history the ability to navigate some of those challenges between different countries and different systems. So I think at the same time, because we're fragmented here, events like the Tech Tour and the Health Tech Summit are really important because they help foster the community of entrepreneurs, to help give them comrades, friends, support network to be able to share ideas and get, whether it's, hey, who's a great regulatory consultant, to, hey, is this VC good to work with or bad to work with? I mean, this is the kind of stuff that they need to be supported to grow their businesses. And in some ways, because we're fragmented as a geography here in Europe, it's less obvious how you make those connections and find that support group. And so events like this, I think, are really great in terms of bringing that community together and giving them sort of the support infrastructure to grow their businesses. So I think things like this meeting are going to help accelerate that. What we also need is for more international investors and corporates to spend time in Europe and see the great work that these companies are doing, start tracking them earlier and give them coaching earlier so that they can be kind of giving them advice to help guide their strategy for what's ultimately going to be successful, not just in whichever particular European market the company might be starting in, but more broadly internationally, because ultimately healthcare is a global business and these companies need help being more globally oriented, and that starts with getting exposure to companies in this area.